Thank you for inviting me. It's a real pleasure. Otherwise, I don't know when I will would be a chance to visit New Zealand. I am president of DEBRA Croatia for 21 years, and now I'm a member of the board, Rare Diseases Europe, a board of directors, and also a member of a social policy advisory group. I'm telling you this because I want to underline that EB is not just a medical issue, it's a social issue, it's a everyday life issue. And I just want to tell you a few informations about the recent survey what EURORDIS did, calling Juggling Care and Daily Life. They performed a survey with 3,000 people affected with rare diseases or carriers in 23 languages across 42 countries. And the main results are, as I will tell you, definitely with all of you will agree that rare diseases seriously impact everyday life, not just of the patient, then the whole family. The results are that 7 in 10 patients and carriers has to reduce or stopped work because of the care of the disease. 2/3 of carriers spend more than 2 hours per day for disease-related tasks. 8 in 10 patients or carriers have difficulties in completing daily tasks, daily routine. And carriers and patients have 3 more times depressions and problems in living, and 3 more times than general populations. Depressions appeared. This is why I joined that social policy advisory group, and I'm as a member of that group involved in InnovCare project, which is now running by EURORDIS, Rare Diseases Europe, and we want to do with the final result of the project will be like recommendation, how to organize, how to make life easier for families, how to organize services, not just medical services, then social services and support of a local community. That's how DEBRA Croatia is called Rare Resource Center for EB. With green, what? Big one, small one? DEBRA Croatia is situated in Croatia, of course, and you can see on the map we are a very small country, also like Wellington, with the same population, like New Zealand, with the same population, about 4.3 million inhabitants. DEBRA Croatia was founded in 1996. By accident, so to say. At that time, I organized a visit of a surgeon from UK, Mr. Mayu, to visit actually my child and to perform a hand surgery. But the doctors from a referral center for EB in Zagreb, they used that opportunity to invite families and to suggest to organize organization, and this is how we started. We started with the main goal get together families with EB to support each other and to disseminate actually information what can be done in UK, of course. And we were supporting families who were able to organize their visit to UK, to go there for some treatments, checkups, and things like this. So we started with a collaboration with St. Thomas's Hospital and with DEBRA UK. We were translating all material what they had. We were copying all what they did, what we were capable to do. And this is how we finally coordinate multidisciplinary team, of course, with the support of a referral center and the Children's Hospital in Zagreb. Today, Today we have a team of more than 15 specialties, nurses, social worker. How come that we achieve this with a lot of advocacy and media campaigning? A lot. So almost everyone in Croatia knows what butterfly children are. We were lobbying for patient rights, so we managed to get all kind of support for family, like mothers can be a carrier with a salary, or they can work half-time and get paid full-time, or they can stay at home for 7 years to take care of our children. So all kind of this services we can get. Of course, at that time there were Yugoslavia at that time when we started with DEBRA, and there were not all that surrounding countries. So we support patients from Serbia, Bosnia, Montenegro, Macedonia, Slovenia, and by years, they organize their own small DEBRAs, but we are still collaborating very much. We will talk about this tomorrow, EB Without Borders. But the families were coming to Zagreb for treatments, for diagnosis, so there were need for a place where they will stay. They cannot just jump in and run out. So they have to be there for several days to get all what they need. So I found the place, actually the apartment and the office where we can organize what we needed to organize. And today we can say that we are one-stop shop for EB. We have 5 employees. There is the main, I would say, person is a nurse, of course. Then the CEO, then a patient coordinator, and the activities coordinator. We have office facilities where we can organize educations for families, education for specialists also, and education for students, people from high school. We are very good collaborating with the universities, so they come for praxis for 1 week, for day, just to see the patient and to talk with the patient. And apartment, 2-bedroom apartment where 2 families can stay at the same time. They have their own bathrooms, each of them, but the living room and the kitchen is for them together, which is a great, I would say, support for socializing. Sometimes this apartment we are using just for weekends to have fun for families, not just for treatments and checkups. So our activities today are 24-hour information service. We are connected with the phones with that VPN system with our members. We are, of course, all the time working on public awareness. That's crowdfunding campaigns, the bicycle rounds for DEBRA. Down apartment, you can see they have meetings in apartment, getting together, having fun with the nurse. And we are bridge between patient and specialists. You know, it's not easy to organize a meeting with the specialists, so we are those who have mobile phones numbers, and we can arrange a meeting with a needed specialist in a week time, not longer. So for every specialist they need, for every treatment, for dilatation, for hand surgery, whatever they need. We were fighting for government-funded dressings and treatments, and we managed to get all free of charge, all Melnike products in quantities we need, which is fantastic. And of course, our nurse is very much involved also in education. She goes around the hospitals and gives lectures about EB. She's also educating families. She's working with students. And we are, as a DEBRA, always organizer or co-organizer of congresses, meetings, and symposium in Zagreb. So we had 2 symposium about EB, the regional symposium, not just Croatian. And we were host of 2 DEBRA international conferences, one in Cavtat in 2001, and last year we were host of DEBRA International Conference in Zagreb. Also, we organize every time when the patients are in the apartment, we use the opportunity to have some workshops, creative workshops, some psychosocial workshops and meetings, which it's a great support for family, for strengthening the family to cope with the daily life. When we manage to collect money, then we have rehabilitation weekends somewhere together, or even 5 days we managed this year to go. And we were in a nice place near Zagreb, enjoying, really having fun and a lot of activities with children. Children were learning how to take off dressings and put on, and they really enjoyed that time. They are having exercise, having fun. So this is very useful, and I think that we should organize this at least once a year, because especially for younger families, that really empowered them to keep on going. Of course, all of this, what we are doing, we cannot do alone. So we collaborate with the referral center for EB, with the Faculty for Social Sciences, Health Sciences, Polytechnics, Children's Hospital, clinical hospitals, other clinical hospitals in Zagreb or across Croatia, Educational Rehabilitation University, Rare Diseases Croatia, and of course, the international collaboration with the members of DEBRA International, EURORDIS, European Rare Disease Organization, with EB House, Salzburg, very good collaboration. So this is what we are doing. So these are some photos from our campaigning. And we had last month, we had a visitors, family from Russia, having a hand surgery in Zagreb. And they were participating at our event. We have a nice event in the evening promoting our Miss of Croatia, who went to China for Miss competition. And she was actually promoting DEBRA organizations all over the world. Financing. This is it. This is it. I don't know how we survived. We survived. Thank you very much.